Hi, good afternoon. How are you? I hope everybody is doing fine. Now, my name is Dr. Khoo. I'm the consultant urologist with Island Hospital. So, what I'm going to do today is to discuss and talk a little bit about common urological conditions that affect both men and women. Now, some of you may ask, what does a urologist do anyway? Now, urologists focus on urinary tract system from the kidney, ureter, bladder, urethra, and also the male reproductive organs. Now, there are certain conditions which is common in both male and female, both sexes, and also there are certain conditions that affect male only. Things like urinary tract infections, urinary tract stones, or incontinence. These are examples of common problems that happen in both male and female. Now, let us look at male first. Now, any conditions that affects the male reproductive organs are of urology concerns. Now, what are the things? Now, any conditions that affect the prostate or issue with fertilities or issue with erections. These are common things that men complains about. Now, let us look at prostate first. Prostate is a walnut-sized organ below the bladder. Now, urology is a very important and part of men's healthcare system. Now, if you look into the scope of urology, when we look into the prostate, because of the location very near the bladder, it can cause a lot of urological problems. Now, what are the common things that happens to prostate? One of the common things is enlargement of the prostate gland or BPH, benign prostatic hyperplasia. Now, as men age, the prostate glands also grows. So what happens when the prostate gland grows? It obstructs the urinary flow. So you can have symptoms pertaining to obstructions of the urinary flows. Now, commonly, they complain of frequency in urinations, problem to initiate urinations, like you need to strain, wait a long time, maybe the streams are weak, or maybe it comes and then it stops and it comes again. Or sometimes it leaks, it dribbles, or you may have to wake up at night to pass urine. So these are common conditions that happen to men with BPH or prostate enlargement. Now, sometimes these symptoms may stabilize or disappear, but most often they gradually become worse. Now, when you have these symptoms, not necessarily it means prostate enlargement. There are other urological problems that may have the same symptoms, things such as infections or bladder stones or malignancy. They also can present the same way. So if you have this problem, consult your doctors. Sometimes these symptoms are not bothersome, but the most important thing is we rule out the underlying cause. Now, what are the things that can affect prostate? Inflammations and infections can also happen in prostate. These are terms prostatitis. If it is due to bacteria, we can treat it with antibiotics, but sometimes we cannot find the cause of prostatitis. Now, how do they present? The presentation is more or less same like prostate enlargement. On top of that, they may complain of pain during micturations, or blood in urine, or blood in semen, or sometimes commonly they complain of pain below the scrotum, that is the perineal pain. So if you have this complaint, seek advice from your doctor. Sometimes prostatitis can be quite confusing with infections of other urinary tracts. So your doctor will be able to assess and rule out the and diagnose the uh, conditions. If you leave it untreated, sometimes bacterial prostatitis can become worse. It can become flare up, become systemic infection, or end up become abscess. Now, the third thing that affect the prostate is cancer. Now, when men heard about prostate cancer, they get very nervous. They get very scared. In fact, any cancer, when they heard about it, they get worried. Now, the key of treat prostate cancer is actually early detection. How do you detect the cancer early? Simple, by screening. See your doctor get your blood test done, check your PSA, consult your urologist. He will examine your prostate, look for any inconsistency in the prostate and any nodules or any growth in the prostate. Now, if the doctors suspect you have or you might have possible risk of prostate cancer, sometimes you need to undergo a prostate biopsy. And if it turns out to be a cancer, we need you to do further tests. Why? Because we want to stage the disease to see whether the cancer is localized in the prostate or has it spread to any other place. Now, prostate cancer is the top 5 leading cause of cancer deaths globally and also in this country. It is always dubbed as silent killer because most of the men has got no symptoms from prostate cancer. And by the time you detect or by the time you are symptomatic, for example, you got bone pain, it is already a late stage, which means it's already spread outside the prostate. Now, over the last 10 years, last decades, there are a lot of advances of treatments for prostate cancer. That is why it is very particular, very important. You sit down with your doctors, discuss regarding the stage of your disease, what are the options that are available, and what are the most suitable options before you decide. Now, prostate cancer, the treatments varies from individual to individual. There's no such things like one size fits all. Again, prostate cancer, treatment of prostate cancer is actually long term. In fact, you need to follow up for the rest of your life because the biology of the cancer changes throughout the uh, throughout the times. So get your screening done early to prevent, to treat prostate cancer. If you detect early, it is curable. Now, apart from conditions that affect prostate, infertility is also a common problem among men. Now, 15% of couples are actually infertile. Traditionally, we blame the women, but that is not true, because 1/3 of these infertile are actually due to men itself. Normally, when they come, they usually normally when they present to our urology clinic, common problems are abnormal sperm or low sperm count or no sperm at all. So there are a lot of medical conditions that can give rise to these problems. Things like varicocele, the dilatation of the vein around the prostate, or infection to the tubes that carries the sperms can also cause blockage of the tubes and sperm cannot be transported. Chromosome abnormality, chromosome defects, or drugs, or tumors of the reproductive organs. These are the other condition is maybe hormonal imbalance, problem with the hormones. So these are the various examples that can cause infertility in men. So if you have this problem, get consultation from your doctors. Your doctor will do certain tests and then it will find out what are the cause. Now, and that's contrary to infertility, some men who has completed family would inquire for vasectomy because they want to be sterile. Now, sperm is being produced in testes. Once it is produced in testes, it is being transported, then it is mixed with semen before the ejaculations. Now, vasectomy actually is a small procedure whereby you disrupt the transport of the sperm. You disrupt the tubes that transport the sperms. We resect the tube, part of the tube that we call it vas, and then we tie up the two ends. Now, after vasectomy doesn't mean you don't produce sperm. Your testes still produce sperm, just that it is not being transported. Now, after the vasectomy, you still can ejaculate. You still have sensation of orgasm. You still ejaculate and you still produce semen. The only thing is there's no sperm in semen. Normally, it's a very small procedure. You can resume your sexual activity within 1 week after the procedure, but you still need to use contraceptions. Why? because even though the new sperm is not being transported, but the remaining sperm in the tube, the one that remains in the pipeline, it is still there. It takes time to be ejaculated. It takes time to clear. That's why in the beginning, after the surgery, you still need to use contraceptions. Right? Now, these are the common things affecting male: prostate issue, fertility issue. The next thing is erectile dysfunction. Now, we'll go to erections later on. Now, what other things other than reproductive organs that commonly affect men and women? Now, the next thing we look at is in stones. Stones is a common issue in this country. Now, your urine contains salts and mineral. They are in the balance. They are in the balanced concentration where these things dissolve. Any imbalances will lead it to crystallize and precipitate and form stones. So, what are the causes of stones? Now, when you talk about stones, diet, what you eat matters, right? Now, in Malaysia, 75 to 80% of stones are actually calcium containing stones, which means if you have a lot of calcium being excreted in urine, the risk of forming stones is higher. But that doesn't mean you don't take calcium. You still take recommended amount of calcium. But what you need to do is reduce your salt intake, because your body has got a mechanism whereby when you reduce the salt intake, it reduces the calcium being excreted in the urine. Now, another common cause of stone is actually low urine output. You may work hard under the hot sun. You may be dehydrated, but yet you take very little amount of of water. When you drink little amount of water, your urine production also low. Your urine become concentrated. What happens is the mineral and the salt cannot dissolve, so it precipitates and it forms stones. These are the commonest cause of stones formation. How you prevent? Simple. Diet. Change your diet. Low salt diet. Reduce oxalate rich diet like meat, almonds, dairy products, and reduce high diets that contain high uric acid. Now, the next thing is drink a lot of water. Studies have shown that if you produce urine 2 to 2.5 liters in a day, is the best method of stone prevention. When I say you produce 2 liters of urine, doesn't mean you drink 2 liters of water, because not all water that you drink will be produced as urine. Some may lost through because of sweat. So you need to drink more. But if you produce that amount of urine, is this the single best method of prevention. Now, sometimes stones are quite small. It doesn't feel anything, no symptoms at all. But when stones grow bigger, sometimes it can give you pain, back pain. Sometimes the stone drop and dislodge in the ureter. It blocks the flow of the urine. So you can have excruciating pain. Sometimes pain from the back, it radiates to the front. Now, it depends on the location of the stones and size of the stone, the treatment varies. Sometimes stones are very small. It can pass spontaneously. Now, big stone, if it gives a lot of problems, pain, block the kidney, and affect the kidney function, something must be done. All right. So these are examples of common urological problems that happen in men. What about in women? Now, there are things that common in women, but also happens in men. Things such as urinary tract infection. When you talk about urinary tract infections, infections can happen in kidney, in the bladder, or in urethra. Now, what are the risk factors? Being female itself is already a risk factor. Why? Because the urethra is short, and the opening of the urethra, the introitus, is near the anus. So it can easily get contaminated. The bacteria can easily contaminate and enters the bladder through the urethra. The distance is very short. That's one of the risk factor. Second risk factor is sexual activity. The more active is sexual activity, the higher risk of getting urinary tract infection. But that doesn't mean if you are not sexually active, you cannot get infection. You can still get infection. New partner, if you get new partner, the risk of getting infections is also higher. Other risk is like certain contraceptions that you use, or feminine wash, irritating feminine irritations, feminine wash that can alter the pH. Postmenopausal also a risk factor because of the declining level of estrogens. It makes the barrier easily breached by the bacteria. So sometimes simple infection can go off by itself by drinking a lot of water. But if it causes problems such as fever or pain, you need to take antibiotics. Your doctor will test your urine to look for what other bugs, common bugs are from your GI tract because it's nearby the anus. Now, if you don't seek treatment, if the infection gets worse, sometimes it can travel upstream and it cause kidney damage. So if you have problems with urinary or symptoms that suggest of urinary tract infections, such as pain during urination or frequency or urgency, you cannot hold your urine, every time you go pee, there's only little amount of urine, consult your doctors. But doesn't mean men cannot have infection. Men also can get urinary tract infection, but it is more common in women. Now, the next common problems, urological problems that can happen is incontinence. Incontinence is more common in women, but it can also happen in men. Now, when we talk about incontinence, we normally want to know what type of incontinence. Generally, you can divide it into stress incontinence or urge incontinence. Stress incontinence happens when you leak your urine whenever you sneeze, cough, strain, or lift up any heavy things. Any things that you increase your abdominal pressure, you leak the urine. Now, why is it more common in women? Women are unique in the sense that they experience pregnancy, number one. They have child delivery, and they experience postmenopausal. So these three things itself already contributes to stress incontinence. Why? Pregnancy, the stress of the growing fetus, multiple child delivery, and postmenopausal all cause weakness of the pelvic floor muscle. Now the pelvic floor muscle supports the bladder, and the muscle around the urethra, it sort of give like a pressure, a pinch at the urethra so that urine doesn't leak. So when these things are weak, a little bit increase of pressure can cause leakage in urine. Now the next thing is urge incontinence. Now urge incontinence happens when you have sudden desire to urinate, compelling desire to urinate, but before you could reach toilet, you leaks out the urine. That is called urge incontinence, and commonly it is associated with overactive bladder symptoms. Sometimes you have got both components together. We call it mixed incontinence. So if you have issues with incontinence, get advice from your doctor because we need the treatment is different. We need to determine whether it is stress or is it urge or is it a mixed type of incontinence. Sometimes stress incontinence, if it is not severe enough, you can do Kegel exercise or pelvic floor exercise to strengthen the pelvic floor muscle. If it is due to urge incontinence, sometimes you can do bladder training, biofeedback, or sometimes certain medications to relax the bladder and to reduce the contraction of the bladder can help. So these are common things that can happen to both men and women. And in men, if you got stress incontinence, usually it's probably due to surgery. Surgery to the prostate itself can destroy the sphincter and leads to incontinence. So these are the things that this example that I mentioned just now are all common urological problems in men and women. Stones, infections, incontinence. In men, you got additional issue, erectile problem, fertility issue, and prostate issue. Now, next, we talk a little bit about erectile dysfunction. What do you understand by erectile dysfunction? Now, by definition, erectile dysfunction is defined by inability of men to maintain erection sufficient enough for satisfactory sexual activity. So the definition is very vague. Satisfactory sexual activity. Different people might have different types of satisfactions. Now, how common is it? Now, if we look at the data. Data shows that as the age increase, the incidence of erectile dysfunction also increases. At the age of 50 to 60 years old, as high as 40% of men suffered from erectile dysfunction. And when you grow older, 60, 70 years old, the incidence increases, some as high as 60%. What about in Malaysia? Now, data compiled from few years ago shows that the incidence of erectile dysfunction in Malaysia is as high as 40 to 50% among male age group of 50 to 60 years old. But for those who suffer across all age group, those who suffer from severe erectile dysfunction, the percentage is around 20%. Now, as man ages, right, the sexual function also impact. The erection become less rigid, less turgid. Now, the refractory period between each erection also prolongs. The ejaculation might not be that forceful. Sometimes even the ejaculate, the volume of semen might also reduce. So this is a natural process. So is erectile dysfunction, is it a disease? No, it is itself is not a disease, but it is a symptoms underlying. Now, what causes erectile dysfunction? Now, the most important thing, you want to find out what causes erectile. You want to know whether is this a psychogenic causes or is it organic causes. Now, psychogenic causes such as psychiatric conditions like depression, anxiety can lead to erectile dysfunction, or psychological issues such as stress, mental stress, relationship issue, or performance anxiety. These are the things that can lead to erectile dysfunction. Organic causes. What are examples like hormonal causes, your endocrine causes, metabolic problems, or your vascular causes? Because when you talk about erection, it means blood flow. Okay, blood flow that helps the erectile tissue expand. So anything that can cause vascular problems can cause erectile dysfunction. Drugs, recreational drugs usage can lead to erectile dysfunction. So when you see your doctors with complaint of erectile dysfunction, most of the time your doctors will take comprehensive medical history, sexual history, and psychosocial history, because it is important. We want to know what are the reversible conditions. All right, it is a treatable condition. Now, how do you treat it? The first line of treatment is medications. 75 to 80% of men with erectile dysfunction can be treated successfully with medication. Of course, there are many types of medication, different brands of medications available at pharmacy. Common things like Viagra, like Viagra and also Cialis. These are the two common things that most men will know. Okay, is available. All right, there are other brands as well, such as Levitra, Udinavir. Okay, these are, I mean, less available in the markets. All right, so medication works, 70 to 80% works. But some men they complain. Why? Because you need to time. Sometimes you need to time 1 hour before the sexual activities. Now, medication, what type of medication to choose? There are so many brands. There are Viagra, there are Cialis. Which one to choose? All right. Now, again, it depends on personal experience and also personal preference. Apart from that, it also depends on how active men are. Because these medications, some of them are short term, some of them are long term. The other thing is, like I mentioned just now, some men are not happy because they need to plan. They want something more spontaneous. And now we have tablets with a lower dosage where you can take every day, and you don't have to plan 1 hour before your sexual activity. So it leads to spontaneous intimacy. Now, other than medication, what else? There are other devices such as vacuum devices. Okay, medical vacuum device, not the device that you can bought easily outside. All right, this is a medical grade device. Now, nowadays, there's another new modality which we call shockwave treatment for erectile dysfunction. Now, shockwave is relatively new in Malaysia, but it is commonly and widely available in overseas. There are a lot of numerous data and papers that say shockwave does help. Now, why shockwave is so popular? Because it hardly got any side effects. No side effects at all. What you do is take a probe, apply the shockwave on the penis. Probably the only side effect is the tingling sensation that you felt when the shockwave is being delivered. Alright? There are a lot of studies that say shockwave can successfully treat erectile dysfunction. But before you choose shockwave, you need to consult your doctors because not all types of erectile dysfunction can be treated with shockwave. Only certain types, such as especially those due to vascular causes, can be treated with shockwave because the principle of the shockwave is improve the blood vessel, improve neovascularization. Now, if everything doesn't work, the last resort will be penile implants. Alright, that's the last result. Of course, this is the most invasive type with the highest morbidity compared to others. But as I said, 70 to 80% of them can be treated successfully. So if you have problem with erectile dysfunction, consult your doctors because we need to see which one is reversible. Things that are reversible, we try to reverse it. Things that are organic in nature, we can try to treat underlying causes. Because erectile dysfunction not only giving stress to yourself, but it also give stress to partners. All right. Now that's a basically overview of conditions that common urologic conditions that affect men and women. Now, I'll take a few questions, incoming questions, right now. Okay, now one of the question is, how do you prevent prostate cancer? This question from William. Okay, how do you prevent prostate cancer and urinary and bladder cancer, and how do you treat stage 4 prostate cancer? Now, let me talk about prostate cancer first. Now, the most important risk for prostate cancer is age itself. Okay, now other risk factor is race. African American has got a higher risk of getting prostate cancer. Age, risk, age, race, and also family history. But unfortunately, these three things you cannot avoid. You cannot change these risk factor. But there are other things that may help to prevent prostate cancer. Things like diet, low animal fat diet, low dairy products diet, high vitamin E or high selenium may help a little bit in prevention of prostate cancer. But like I've mentioned earlier, the most important thing is detect early. Do the screening. Now, the just now the second is bladder cancer. Now, what are the risk factors for bladder cancer? Important risk for bladder cancer is actually carcinogens that can be found in smoking, cigarettes. Okay, carcinogens can be found in industry such as those who work in painting industry, in textile industry, in this what do you call this rubber industry. They contain a lot of carcinogens that can lead to bladder cancer. So how do you prevent it? Well, sometimes you can't prevent the exposure to this chemical because you are in the line of job. So if you are a smoker, stop smoking. Okay. Now the next is stage 4 bladder cancer. Prostate cancer. Now stage 4 means the cancer is already spread beyond the prostate. Now, prostate cancer feeds on testosterone, male hormone. So to treat metastatic or stage 4 prostate cancer, we need to use hormone, which is called hormonal treatment. We need to reduce the testosterone. Now, depending on individual, sometimes you might need you might need chemotherapy or you might need other forms of target therapy. Like I have mentioned earlier, treatment for prostate cancer is very individualized. What is best for you might not be best for other people. So you need to consult your doctors, because we need to see, when you say stage 4, is it only the bone, the burden of the disease outside the prostate, any organs that are involved, what is your functional status? So these are all the things that we need to take into consideration before we decide what are the best modality of treatment. Okay. Now, the other questions that posted is leaking of urine when you cough or when you sneeze. Well, I mentioned earlier, when cough or when you sneeze, you increase the abdominal pressure, and the pressure can be transmitted to the bladder. It leaks. These are called stress incontinence. But we also need to get history from you, whether is it purely stress, or is it there are other forms of incontinence as well, or a mixed forms of incontinence. We also need to get other surgical history from you. Any history of pelvic surgery? What about your delivery, obstetric history? How many deliveries you have? All right, and the age, the menopausal. So these are the things that we need to consider when we are dealing with stress incontinence. Sometimes simple things like Kegel exercise or pelvic floor exercise can strengthen the muscle. But of course, if the leakage is so severe and it affect your life, affect your daily activities, some things need to be done. Some corrective form of surgery can be done to reduce the leaking. Okay. So another question is signs of kidney stones. Now, mentioned earlier, if the stone is small and it is in the kidney, sometimes it doesn't give any symptoms at all. Sometimes you might just have a dull pain at the back. But if the stone has dropped down, that is when you have excruciating pain. The pain comes like a wave. That's why we call it colic pain. Now, pain is the commonest signs of kidney stones. Other than pain itself, sometimes you may have blood in the urine. Okay, now sometimes there's no symptoms at all. You might detect stones when you do a medical checkup or do other imaging, and then instantly you find stones. Sometimes it can present as infection. Some people has got frequent infection, and when you investigate, you find, oh, the source of infection is actually stones. Okay, now other questions, the incoming question is blood in your urine. What do you mean by blood? Now, when you talk about blood in urine, there are two things. One, did you see blood in your urine? Blood in urine means hematuria. Now, if you see blood in the urine, that is called visible hematuria. That means your urine is red in color. It is mixed with blood. Now, another type is that your urines are normal clear color, clear yellow color. But when you send the urine to the lab to get tested, then there are red blood cells. There are blood that can be tested in the urine. Now, what does it mean? There are a lot of conditions that cause blood in the urine. There are benign conditions and there are malignant conditions that can cause blood in the urine. But if you can see blood in the urine, it is of urological emergency. You need to consult your doctors. All right. Sometimes your doctors need to do a cystoscopy to have a look what is happening. The most important thing we want to rule out is actually, do you have a malignancy, urinary tract malignancy? Sometimes it can be a benign causes. If it has got mixed with other symptoms like a pain during urination, fever, things that suggestive of infective causes, sometimes that itself can also present as blood in the urine. Severe cystitis itself can cause blood in the urine, or big prostate, because prostate are actually very vascular organ. Sometimes it bleeds, it can cause blood in the urine. So, like I mentioned again, the second condition is when you send the urine to the lab and then you saw red blood cells in the urine. So now, if your urine tested clear the next two consecutive reading, actually you don't have to worry that much. But if you have persistent blood in the urine, you need to get consultations, because sometimes you need to find there are causes that contribute it. Stones can also cause blood in the urine. Now, 5%, 5% of urinary tract tumors can give blood in the urine, which is not visible. When you test, you can see blood in the red blood cells in the urine. So it is necessary when you get blood in the urine, go get checked out. Sometimes you cannot find any causes. Sometimes the blood is you get a kidney problem. Kidney disease itself can cause blood in the urine. Okay, so when you see blood in your urine, get consultation fast. Okay, and next question is, uh, should you be worried when you go to the bathroom more often lately? Now, when you say you go to the bathroom more lately, again, we need to ask you the questions. Does it happen recently or has it been ongoing? Any other symptoms are not as well? Because sometimes infections can also give the same presentations, or presence of stones can cause this problem, or malignancy also can cause this problem. Now, we need to rule out all these causes. Now, sometimes what you encounter could be just benign conditions such as overactive bladder. But before we say you have overactive bladder, we need to make sure you got no other condition. So overactive bladder, the presentation can be frequency to urinate. Sometimes some people are severe enough, every half an hour they need to urinate. It can affect their lifestyle, because whenever you go for a movie, you can't finish the whole 2 hours movie. In between, you need to go to toilet. Or when you drive a long distance journey, every stop, every single station, you need to stop because you need to urinate. The urgency is there. Of course, this kind of condition we can treat. So before we say this is overactive bladder, see your doctor, because we need to rule out any other condition, more worrying conditions. These are overactive are actually benign condition, but it is treatable. Okay. Any other questions? Okay. The next one is over the counter herbal medications, all right, to help with the sex life or urinary problems. Now, let me talk about urinary problems first. There are a lot of supplements that are being sold in pharmacies, all right, things like tomato extracts, saw tomato or pumpkin seed. These are common things that you can buy in pharmacy. Basically, these are all called phytotherapy. Now, this phytotherapy, they contains phytochemicals that sometimes they contain a lot of zinc, which is good for prostate, or sometimes they contain chemicals that can reduce the testosterone level in the prostate. Yes, sometimes it does help with urinary problems, because the mechanism it works to reduce the testosterone level in the prostate. So generally, these are all plants extract. Generally, it is safe. But when you talk about over-the-counter medication to help your sex life, you have to be careful. Now, all these remedies, all these herbs, this powder, drinks, or this tongkat ali, no, a lot of them are not approved by the Ministry of Health. So if you buy this over-the-counter medication, be careful, because it's not regulated. Now, if you analyze we have incidents few years ago where certain things are banned from selling, because they found out these aphrodisiacs medication contains substance that is very similar to Viagra, and is being sold freely without any prescription. So when we talk about all these herbal medication, all generally be careful. I mean, don't recommend you buying all these over-the-counter medication to improve your sex life. All right, seek consultation from your doctors. So the next question is PSA. Now, if you got high PSA, does it mean that I have prostate cancer? Now, PSA is a tumor marker for prostate. It is called prostate specific antigen. It is only specific for prostate organ. But when it's high, it doesn't mean you have prostate cancer. We want to see how high when you say it's high. Okay, there are a lot of conditions that cause high PSA. For example, if the prostate gland is big, every single tissue contribute to the PSA level. So generally, if you've got a big prostate, the PSA can be high. Or infections in the prostate, prostatitis also can cause high PSA. Any instrumentation, recent ejaculation also can lead to high PSA. But of course, the most worrying is prostate cancer. So PSA is a tool to be used for screening of prostate cancer. When you talk about PSA, we don't look at the PSA per se. We look at other parameters. For example, how big your prostate gland is, and what are your serial PSA reading. Does it increase very fast over a period of time? So from that, we make some calculation and we take into consideration whether are you at risk of having prostate cancer. Basically, the PSA is just to tell you what are the percentage, what are the risks of you having prostate cancer. But of course, if the numbers are very high, such as in 100 and in 1,000, then you know it most probably is a prostate cancer. But the numbers are not that high, maybe 4 or 6 or less than 10, then we need to look into several other accounts. Okay, so sometimes your doctors, when we suspect you probably at risk of having prostate cancer, will advise you to get a biopsy. Or sometimes we need to do other tests such as MRI of the prostate, because MRI of the prostate also help us to see any abnormal lesions in the prostate, because it can help us to target a biopsy. So it depends on, when you say high, how high is it? All right. So common is erectile dysfunction. I mentioned earlier, if you grow older, the higher risk, the higher incidence of getting erectile dysfunction. Okay, like Malaysia, 40-50% of men above 50 or 60 years old will encounter erectile dysfunctions. Okay. Another question is erectile dysfunction, is it a health problem or is it a psychological problem? I've said erectile dysfunction is not a disease, it is a symptom, but it can be an indicator that you might have other underlying health problems. For example, if you got erectile dysfunction, you might want to check if you got any cardiovascular issues or not, or be, you might want to look for any metabolic or any endocrine issue. So it it is an indicator for other health problems. Psychological, yes, of course, is a psychological issue because it affects your life, it affects your partners, okay, the relationship with partners as well. Now, second is how to prevent erectile dysfunctions. Now, uh, erectile dysfunctions, you see, the things increases when men get when men becomes older. So it's a physiological phenomenon. Okay, I mean you cannot say, oh no, I want to stop erectile dysfunction, because it's an aging process. Like I said, when you age, your sexual function also decline, but it can be treated. Okay, it is a treatable, very treatable conditions. Yeah. Is it possible to have a little bit of ED? Yes, of course, it is possible to have a bit of ED. Sometimes you are stressful, sometimes for young couples who just engage in sexual activities, they are worried about performance and anxiety, sometimes stress from your working conditions, okay, any other matters that affect your psychology can have a temporary or little erectile dysfunctions. And the thing is, the second question is, can it be permanent or can it be cured? Now, when you mention cured, you have to look what are the causes. If it is a reversible causes, yes, of course you can reverse it. But sometimes if you modify your lifestyle, you change your behavior modification, lifestyle changes, or sometimes it does very little help. All right, it can be treated, like I said, but at a cost. Okay. Any other incoming questions? Okay, if there's no incoming question, I will stop here. I say I'll thank all of you and thank you.